Alrighty, so the importance of the respiratory system to understand that supply of oxygen is it's important for human beings, and without it, we die in a matter of minutes. Okay. Also, we can understand the function and the vital exchange of oxygen and carbon dioxide that happens in the respiratory system. And then we're gonna understand and explore the structure of the respiratory system, which includes like your nose, your nasal cavity, your pharynx, your larynx, your trachea, your bronchial tubes, and the lung itself, okay? And understand the lungs are, are spongy tissue that has blood vessels there, connective tissue, and microscopic air sacs where the exchange happens there, and called alveoli. We'll go through that too. And so it's a network of capillaries that bring in blood into contact with the thin walls of the alveoli, and that's where the exchange happens. Anyways, but for now, we understand these three things that we need to learn: the major organs and the three levels of respiration, and we're going to describe breathing as the process of how it happens. Okay, so let's look at this graph right here together. And keep that page open in your book if you find it, okay? Talking about the sinuses, right? When we're congested, there are sinuses kind of above your nose, between your eyes right there. You got the nasal passages run down the cheeks, right where your zygomatic arc is. The roof of your mouth, which is the palate, the top roof, the bone. Yeah, so we got the oral cavity where we ingest the food. The tongue is also part of the, the tongue is part of the digestive system, but it's the anatomy of here. We have the lower jaw, the bone. We have the pharynx, so it's the tube. So from your mouth, we got a tube going down where we get the food to. We have the epiglottis, which is this flap that allows the food to go through the pharynx and not through the trachea, right? So trachea is only for air, while the pharynx, where it goes down to the esophagus later, is where the food goes through. So we have this epiglottis mechanism that helps when we eat for it to close, and when we breathe, it opens. Okay, larynx is your voice box. Trachea is, think of it as the trunk of the tree, the stump of the tree. And this trachea, what's called brachial tree here, branches into bronchus, left and right. And then from there, it branches into everything else. But from here, you can have at least a view of the upper and the lower respiratory. Okay, so what are the three types of respiration? Right here. First, we got external respiration, and that's between the air in the environment and the blood. So it's the exchange between the environment, and it takes place in the lungs. So we breathe in the air. So in the cardiovascular system, we have the relationship between the heart and the lungs, right? That we learned, and that's how the blood gets oxygenated with oxygen, is through the lungs. And then the other side in the cardiovascular is where the blood will be pushed out to the rest of the body. So the respiratory system works hand in hand with the cardiovascular system. So beside the external breathing from the environment with the blood, we have the internal environment that happens in the body after the blood is being pumped from the heart to the rest of the body. So that's the blood is sent towards the cell, okay? So the exchange is between the blood that's been oxygenated and the actual cell. Then we have cellular respiration, which happens inside the cell on a cellular level. So this is kind of the smallest mechanism here. So we have external environment, we have external environment to the blood, then internal is from the blood to the cell, and then we have things happening on a cellular level. So how does the process of respiration happen? First, we inhale the air through our nose and not from our mouth. Okay, it happens from our nose for a reason. So it begins to inhale through the nose and it passes through the nasal cavity. Why from the nose and not the mouth? Because it gets warmed from the nose, the air gets moist, and also the air gets filtered. After that, it passes through the pharynx, and the larynx, and then to the trachea. So keep that picture that you have in your book there so you can have an idea of what I'm talking about. From the trachea, it's going to divide into two branches, one to the right and one to the left lung. And the branches also subdivide into smaller branches like a tree, and they're called and become bronchial trees. So for the two major ones, and then you have more branches out to even smaller ones till we get to the alveoli level. Okay, next we have air, then moves down to the bronchial tree, like we said, and reach the end of the passages, which gets to the air sacs called the alveoli, like I said. And then the air from there moves through, and then the air from there gets diffused. So the alveoli is the sacs. Let me go up one notch. So the sacs right here, the alveoli sacs, is these ones that you find at the end or the smallest part in the lungs, where these sacs have the capillaries where they have the exchange, just like in the heart, just like in the cardiovascular system, same thing, where the exchange happen right here. Okay, so they're thin and they're porous, and they're surrounded by these capillaries. So these are capillaries, which is the smallest vessel in the body. And the largest vessel is aorta and veins, and the smallest are capillaries. Okay, so
what it goes what at the end of our lungs, what is this?
Here?
How the system works with this?
Well, first,
it's lungs, it's bronchitis, right? It's bronchitis, and bronchitis goes what?
Bronchitis is going to come after, which we're going to talk about the dysfunction, okay, and the diseases of the respiratory system. Right now, I just want you to follow me carefully of the process of from where the air goes into the lungs, and
right.
You need to know where does the air in the lungs get filtered, and what is that process called? So when we get the air to the bronchioles, to the alveoli, which is the smallest sacs in the lungs, that's where the exchange happens of oxygen and carbon dioxide happens. And that process is called diffusion. So I'm going to go, so this is one step at a time. I'm going very slow. So bear with me a little bit, and then you'll understand everything. Okay, so the process happens as this. From the alveoli, then so let me repeat that for you again. So walls of the alveoli are surrounded by capillaries, which is vessels, okay, from the circulatory system. We're good. Now blood enters the lungs through the pulmonary artery. That artery, pulmonary artery, carries deoxygenated blood. So it has high concentration of carbon dioxide. And then it will be picked up from the cells of the body at a lower concentration of oxygen. Now, oxygen concentration in the alveoli is greater than the one in the blood. That means the alveoli have more oxygen than the blood that goes to the body. Where carbon dioxide in the blood is higher than the alveoli. So that's the idea that, so the most highest oxygen supply you're going to find in the alveoli. So through diffusion, So diffusion is something where something high concentration, low concentration, two spaces with different concentration kind of blend together. And the one with higher concentration will move to the lower concentration. This is the idea of diffusion. And we're talking here about oxygen and carbon dioxide. So we're talking about the levels of oxygen and carbon dioxide and how they diffuse in the alveoli. So what happens is the blood will take the oxygen at the alveoli level, and then it's gonna get pumped back to the heart, and from the heart it's going to go back, goes through the body. Okay, oxygenated blood is carried by red blood cells, okay? And it goes back to the heart and then circulates through the body into the systemic circulation. Systemic circulation is the circulation that goes through the rest of the body. Remember, we have pulmonary circulation that happens in the lung and the heart, and then we have systemic circulation that happens from the heart to the rest of the body. So here the process is simple. Oxygen carried to the heart, then to the body. Diffusion between the tissue and the cell happens. Cells use the oxygen that's been provided to produce energy. We know every cell is going to create metabolic waste, okay? Because it's a live thing. It takes in nutrients and it pours out toxins. Then waste products are removed in the blood. Carbon dioxide is going to go carried back through the veins to the lungs, and carbon dioxide diffused into the alveoli and inhaled. So the carbon dioxide is going to go back to the heart, to the lungs. It's going to get filtered by the alveoli sacs, and then from the lungs, from the alveoli, is going to go back to the heart, and then from the heart is going to pump the oxygen-rich blood to the rest of the body. Okay? Now, let's talk about breathing. There is two phases. We have inhalation and exhalation. You with me? In the inhalation process, what happens is you have the ribs, right? We have ribs and we have muscles that are attached between the ribs called intercostal muscles. As the inhalation happens, what happens? Muscle contract. We lift up the rib cage, okay? We expand the thoracic cavity, which holds the lungs, okay? That's it, it's just the lungs. As we inhale, it raises the ribs and expands the cavity. Now, what happens to your diaphragm? Your diaphragm, which is below your rib cage, right? It feels like it's on, like underneath your xiphoid process, right? Above your stomach. So that area. So as we inhale, I'm gonna show you guys a video and you'll see how that looks. But so the diaphragm goes up and goes down, goes up and goes down. So with the inhalation, it's gonna contract and it's gonna pull down the diaphragm. And what does that do? It creates more space for the lungs to open up and breathe. So inhale comes in, expansion of your chest or rib cage, and depression of your diaphragm. So that creates more space for the lungs to open up and take in that air, that oxygen. Now, as we exhale, what happens is relaxation. So the intercostal muscles are gonna relax. And the diaphragm that's been contracted, pushed down, is gonna also relax. So diaphragm relax, the lungs relax. Now, in the forced exhalation scenario where we're pushing the air with force, what tends to happen to the intercostal muscles and the ribs, they collapse and kind of tighten together. And the abdominal muscles also contract, which kind of push into the diaphragm and they push into the thoracic cavity. So that creates, so everything kind of comes collapsing together or coming contracting together. That's what happens with forced inhalation. Awesome. Now, when we talk about the rate of breathing, okay, rate of breathing. Now, this is in an average adult, okay, not taking in sick adults or taking in athletic people, or we're taking in just an average adult. Healthy average adult can take in, inhale, exhale is one cycle, about 10 to 20 times a minute. So usually I do an exercise and we count our breaths. So we'll probably do that tomorrow, where we practice, where we time ourselves a minute and see how many breaths we take in. I had some people take in 12. I had some people even take in 22 breaths. So the more anxious you are in the sympathetic, for example, state, you will have more breaths taken in and taken out. When we are more relaxed, okay, and we're not doing much of anything, we will have a lesser rate of breathing. Also, other things that will play a part in your rate of breathing is, of course, your physical ability or your fitness, your cardiovascular fitness. So athletes can go really low with the breath. Okay, older people will go higher. And like I explained, in the sympathetic or parasympathetic is going to go higher, and the parasympathetic is going to go lower. Relaxed or tense. Now, if a client have difficulty breathing normally, suggest he or she see a physician. Now, if you have clients that on the table and they're not able to breathe and you're guiding them to breathe, like take an inhale, exhale, and you're finding that they are barely having any chest expansion. Because like we said, when we inhale, we should see an expansion in the ribs. We should see some sort of lifting in the chest cavity. We should see some abdominal movements. Now I'm talking about clients laying down on the table. It's very easy to see that because they're completely relaxed. If you see that they're having issue with that they might have some respiratory issues, okay? So when we're talking about breathing, positive breathing should be deep. Deep exercise is good. So tomorrow we'll do some exercises for breath to help you increase your mental capacity, help you also get into the parasympathetic by just doing simple breathing exercises. And we guide our clients to do the same throughout the session. That's why I say try to get your clients to breathe, minimum 3 to 6 breaths per session. It will help them a lot. Because if you don't guide them to breathe, they're not going to learn how to breathe unless they are in a class that's been teaching them how to breathe, or they're exercising, or from that sort. Okay. Okay, now the common colds or common disorders in the respiratory system, it's going to be, we've probably all experienced a common cold, right? A common cold, there's over 200 different viruses out there, yes? And common cold usually spread through physical contact. Some of the symptoms that you're going to see here is going to be nasal discharge, congestion in the chest, temperature, high fever, sore throat, dry throat, headache. All these terrible things usually happen from a common cold, which we all have experienced at some point or another. Now, what can you do for massage considerations? So massage is contraindicated when you're in common cold, when you're infection and when you're inflamed. Okay, so in the acute stage, common cold, because the respiratory system is already overtaxed, it's already overworking when it's sick, it's trying to compensate, but the body's not functioning properly. So we wait for the acute stage to pass, and when they're feeling a bit better, where they're not completely congested, because you're going to make that worse with massage, okay? And then it's gonna actually, I had that happen to me where I was, you're supposed to wait at least 3 to 5 days. 5 days is ideal to give a massage for somebody that has a cold. So I had like light symptoms on my first day. I had somebody give me a massage, and 3, 4 hours after that massage, I went home and everything worsened like 200%. It was terrible. So if I just rested and maybe took some vitamin C capsules or something to help my immune system and rested, it would have helped me better than the massage. Because what does the massage do? It's going to help the virus to spread even more in the body. So the symptoms get really, really bad. So do not get massage when you have a common cold in the first 3 days, okay? Wait till 5 days or so and then get the massage.
I've made that mistake too. Makes it significantly worse.
Brutal, very brutal. So I will never do that again. And I actually wanted to see what would happen. And I'm curious cat, and that's what happened to me. Okay, awesome. What else? Okay, that's pretty much it. What we're gonna do with the common cold. Now with the influenza, and now it's a also a viral infection similar to the cold, but it's caused by different viruses. Okay, it can be spread through physical contact, and it can be spread also through to the air as well. Now, symptoms of influenza are going to be fever and achiness, maybe chills sometimes. Can last more than 3 days, so it has more time. After fever subsides, symptoms like coughing, sneezing, and congestion stay. So you're gonna probably wait at least a week or two till everything kind of feels better to work with these people. But you need to let them know if they're being stubborn about it. You need to let them know that this is gonna happen. Like you might really get worse. Is this okay? Because at the end of the day, you can tell people they decide if they want or don't want. Okay, unless you yourself very uncomfortable with the idea. But if they insist, it's they're on. They're adults. Okay. So complications of the body, like um, you might get possibly a secondary infection, such as bronchitis or pneumonia increase. So the concern is for people with pre-existing lung condition or older people or young people, like really young, is to be careful with those people. These are the complications that could happen too. So intuition is good in these things. All right. For massage consideration, kind of the same thing. You want to wait for the subacute. Subacute meaning that's the ideal. Subacute meaning you're recovering and you're feeling better and you don't have the major symptoms. It takes from 3 to 7 days for the acute, and the subacute is after a week, and usually people are recovered by that time. Okay, so this is influenza pneumonia. So it's inflammation of the lungs caused by many different viruses and bacteria. So we're talking about symptoms that also have coughing, chills, and high fever. So it's bacterial, causes aches, chest pain, sometimes also gross type of phlegm, yellowish, greenish phlegm, all that stuff. And treatment can differ between pneumonia. Same thing, massage treatment is the same for many different types of pneumonia. So they should probably see a doctor for this pneumonia thing because can get really bad for some people. And it's not a joke. What can you do for massage recommendations? So massage should only be applied for pneumonia patients when the infection, again, has reached a subacute stage. And even then, ask them, does your doctor recommend you get a massage? Okay, so it's not like a common cold or. So ask and be precautious, especially if you're doing any um, like percussive massage, not percussion, where like we do this percussive with a thorgon or with your hands. Usually, we use those kind of massage techniques to 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 open up the lungs. Okay, cupping over that area Also proven to help assist in loosening up the phlegm from the alveoli in the bronchial tubes, okay? So this is one technique that helps as bringing pounding and vibration to the back of the lungs. It kind of shakes the mucus off, and these kind of consideration that you can do. Now, contraindication for this case is, again, going to be the same thing, is the acute stage. The beginning stage, no massage. They recover, then you start doing them, gentle to help them with the lymph and opening up the nasal passages and working around the thoracic area, all that stuff. Okay, next one, sinuses. This is allergic reaction, nasal obstruction, or infection. So you'll see swelling of the paranasal cavities, reaction to allergy, obstruction, or inflammation. Now, what symptoms you can have with that is tenderness, pressure headaches, runny nose, congestion, sometimes facial or like tooth pain. Now, massage, as long as the viral infection is present, massage can be, if there's no, how you say it, the infection is gone, then the same thing. Massage can benefit people with opening their passages and allowing them to help them breathe. But again, if there's inflammation, this word, you'll see it all the time, itis, inflammation, they have the same thing. We have the beginning stages, which is the acute, 3 to 7 days. You need to be cautious. After the 7 days, we got the subacute stage. That's where we are introducing things to them that would help, but we're not being aggressive. And we talked about the stage after the subacute, which is chronic at that point. This we could do lots of things, but by that time, a person is recovered, but they're just having certain issues that are persisting. And then you can do a lot of other things. There's nothing to be scared of in the chronic stage. It's between the acute and the subacute. Then we have tuberculosis, called TB. So it's called by airborne disease, so through the air infectious disease, by the Mycobacterium tuberculosis bacteria. So these incubates in the fleshy pockets called tuberculose, and new maturation is surprisingly drug resistant. So the new mutation, that means the new mutation of this disease is resistant to the drug. So TB, again, it's a bacterial infection and incubate in the body without even knowing it. That means it could be in your body, hiding, and you can't tell that you have it. So location is most likely in the lungs, right? And the bacteria may be transported from the bloodstream to the tubercles, forming in other parts of the body, like the bones and the kidneys. That's why they have a vaccine for TB. And it's more present in the third world countries. So they give you like a shot when you're a little kid. Okay. Other diseases. So once infected body, so the minute the person immune system is attacked, it's gonna be weak, okay? And the disease is gonna be contagious. So all respiratory diseases you wanna stay away from. So it's not worth it for a client even to come in if they're also sick, because they might get you sick and then you are out of commission. And all consideration of massage for the respiratory system is the same for all systems. If you have noticed, as we're going along with all the systems, we're noticing that we need to identify what stage the inflammation is in, how many days has it been, what is the symptoms the person is feeling, if the person is having temperature, heat, extreme congestion, that means the body's working to fight the disease, and it doesn't need you to come in and make things worse. So rest, hydration for these people is going to be the best thing. So that would be it for the respiratory system. I'm going to stop recording right now, take questions, and we're going to do some exercise.